am on the road. I've got another 3 hours to go before I reach Redwood City to Stanford University to have my consultation with Dr. Stanley Liu. Originally, the plan was to talk to him about double jaw surgery, but it's looking like I might have to ask him about the dome surgery too, which is the surgical assist treatment to my MSE, which doesn't seem to be going great. And I figured now would be a good a time as any to give a little update. Here's a photo of my device at day 22, which is today, and still no diastema, no gap. The screws, I mean, I don't know, they seem like they're getting farther apart, but no expansion that I've noticed. You can see that I'm starting to have a lot of inflammation in the tissue where the screws are. I don't know what's happening there. I hope it's not an infection or anything. I've been trying to keep it clean, but it's pretty difficult. Anyway, I'm gonna ask Dr. Liu about all of this tomorrow. I also started to notice, it's really minor and it comes in waves, but I notice some pressure on my teeth, a little bit of soreness. I wonder, since the device is expanding but the bone is not, some of the pressure is starting to transfer onto the arms of the MSE and is starting to push my teeth. I hope it's not tipping it. So my MARPE/MSE treatment officially failed. I talked to Dr. Liu. He's the ENT surgeon at Stanford. He's a colleague of my orthodontist, Dr. Yoon. And one of the first things he said was, yeah, you got to do surgical assist. This isn't working. In fact, he said that he would have called it quits after 1 week of failure. Nonetheless, I was doing it well into the end of week 3. So he's recommending, like I had suspected, for me to do DOME, which is a surgical assist protocol to MARPE. Specifically, though, he wants to try his new protocol called DOME Mini. DOME Mini stands for Distraction Osteogenesis Maxillary Expansion Minimally Invasive Nasal Endoscopy. And it's basically the traditional DOME procedure. You know, I've talked about this before a lot. They do a cut along here to relieve a lot of the tension of the resistance of the MARPE device. So this is called the Lefort 1 cut. And so traditionally they'll go up into your gums and they'll just do the cut through your gums, right, along here and here. And then also in DOME, they do a mid-palatal cut along here. So with DOME Mini, it's all done through the nose. So they have a camera and this new little saw or whatever, and they go through your nose and they pull back your tissue and they just cut right through here and here and then down here. It all happens through the nose. You're not left with any visible scar tissue. He said that DOME Mini is almost certainly going to be less painful. The whole process is going to be less painful than my original MARPE installation, which is like really surprising to me and really exciting. He did also say that he's only ever done this new protocol on 30 patients, so it's a pretty new thing. And one of the things that I asked him, I've been waiting to ask him this question for quite some time. I know I brought this up a lot on the channel, is what about the trade-off of the Lefort 1 cut, that cut here? Obviously, the expansion is going to be a lot easier and it's almost certainly going to be more successful. But what about other treatment protocols that don't do a Lefort 1 cut? I talked about how you have the nasal aperture, which is an opening in your skull behind your bone. And if you don't do a Lefort 1 cut and you have successful expansion, then your whole midface tilts outward, expanding the width of the entire nasal aperture instead of just what's below the cut. He had a lot to say, and it was very, very informative. I specifically asked him about a competitor's protocol called EASE. For those that don't know, this is by Dr. Casey Lee. He does EASE, I think it stands for endoscopically assisted surgical expansion. And basically he only does a cut here, and then he does another cut that I'm still kind of learning about, called the pteromaxillary disjunction, I think. But I think one of the more interesting parts is that it uses a whole different device. You know, this device is not screwed into the top of your mouth. It's screwed to the sides of the roof of your mouth. And so I think there's a lot to go over here, and I'm going to make a video talking about that later. I'm really excited to share what he said, because I thought it was really, really educational. Whether or not it's the end-all be-all, I can't say. But for this video, I'm gonna just resume talking about my own treatment and leave that for the next video. So anyway, one of the things that they did at the office in Stanford, which I liked, was, so I've gotten, and many of you have probably gotten, nasal endoscopies. It's just where your ENT or oromaxillofacial surgeon or your pulmonologist sometimes, they'll shove a camera up your nose and down your airways just to inspect if anything seems enlarged or anything like that. One of the things that they did at Stanford, which I thought was really cool, was they mimicked a drug-induced sleep endoscopy a little bit while they did it. So they had the camera down my throat and they numbed the area so I wouldn't have a gag reflex, which I don't think I've had anything like that before. And they had me do a series of like breathing exercises. So for example, one of them was I close my mouth and I pinch my nose and I breathe. And you know, you can't breathe, so you're creating a vacuum, and it basically mimics collapse in your airways. So it's kind of a budget sleep endoscopy. And so they were taking a look, and one of the things that he noticed is that a lot of the tissues and muscles in my upper airway are very floppy. He specifically talked about the hypopharynx. My hypopharynx is very floppy. And I don't really know too much about the tissue and musculature of the upper airway, you know, and I think this kind of leads into myofunctional therapy a little bit for some. I think that's something I'm gonna start learning more about next. Although he said that restoring nasal breathing is going to lead you on a path to having your hypopharynx tone become much healthier and much more proper almost automatically. So, you know, I don't think that means I need myofunctional therapy. That's what I'm trying to say. So another thing that he wants to do the same day right before we do the Dome Mini is he wants to do also a drug-induced sleep endoscopy. He said it's very unlikely that anything he sees is going to change my treatment, but it's going to be nice to be able to get before and after videos so that we can really take a look at what has been changed and what has been fixed, and I'm super excited to hopefully share that all with you. One note he said, it's just something to bring to your attention. If you are getting a drug-induced sleep endoscopy, or a DICE, I'm going to start calling it from here on out, then the type of sedative drug they give you matters. Some of them more accurately mimic sleep than others. And actually, I think it's debated. Dr. Liu said that Presidex is what he wants to use, which is better than propofol. He said propofol tanks you and makes you so sedated that it's just too dissimilar to sleep. Whereas I've heard there are actually more pros and cons about it, and it's not that simple. Anyway, one of the more interesting things that he said is that he wants to do the genioplasty. And by the way, the genioplasty is the sliding chin surgery that Dr. Wallin wanted to do. Dr. Liu says he does genioplasty in all of his double jaw surgery patients. And he said that he wants to do the genioplasty at the same time as the Dome Mini, instead of waiting a whole extra year after for the double jaw surgery. And there's a few reasons. He says he's been starting to do this lately. One, I'm gonna have better breathing quicker. Again, the sliding chin surgery pulls your tongue out a little bit forward and gets it out of your airway. So I'm gonna hopefully feel a little bit extra better from that. Also, the double jaw surgery, it tugs on certain nerves, and there's a lot of healing that needs to happen. It's a very invasive surgery with a pretty difficult recovery. And so doing the chin surgery, the genioplasty, during a pretty relatively chill surgery, the Dome Mini, is gonna you know, distribute out that healing so you're not putting so much pressure on all these different nerves at once, and you're not going through too much trauma at once. And he says that he suspects that, you know, that could reduce the chances of a patient having like prolonged numbness in certain areas or something. And I was all for it. That sounds pretty cool. I had never heard of someone doing a genioplasty with their surgical assist MARPE. Anyway, towards the end of the appointment, I was super excited, but then he dropped me with some news. He says, yeah, we'll have someone reach out to you to schedule the surgery. My first availability is over a year from now. And I was like, oh no, man. Like, you know, because I already got the MARPE installed and it failed, and I had in my head before it failed that like, oh, how exciting, maybe I'm gonna feel good any day now, or any week now, or any month now. And it failed, and I was like, okay, well, it failed, we're gonna move to the next step, that's okay. And then boom, year from now. Very discouraging. Not to mention there's a whole year of braces after that, not to mention the recovery from double jaw surgery after that. All right, this video is getting way too long. I'm just gonna cut it here, so I'll make the next update in a few days, or something along that line. That's the end of Dr. Liu's appointment. Then, just a few days later, I talked with Dr. Yoon.